Hi, everyone. This is Sean with the Mass Support Network. Well, it's been a while, huh? Last time we checked in was at the end of April, and now May is already gone. So let's take a look at what's happened in the last month and where things stand right now with the pandemic. So this is going to be a slightly different format than we've had before. I want to start with just recapping the major changes that have happened in the last month. So it all started when CDC said that masks were only needed indoors for people who are unvaccinated, leading to all sorts of changes in mandates and statewide protections. Massachusetts accelerated its reopening timeline. You may recall our last update listed various dates that everything from restaurants to ball pits could reopen. All that kind of went out the window with the new CDC guidelines. And as of yesterday, the mask mandate in Massachusetts has ended. The state of emergency is due to end on June 15th as well. So we're in kind of a different place than we were in a lot of measures. Of course, one other positive news is that the vaccinations have opened up for children as young as 12 years old, with Pfizer and Moderna being shortly behind them. We are also looking to see that full FDA approval, not just emergency use authorization, should be coming down the pipeline pretty soon for the mRNA vaccines, with Johnson & Johnson possibly behind that. So with all that, what is the pandemic now? Is it over? Are we still, what state are we in? These are really good questions to ask right now when so much has changed from where we were just a couple of weeks ago. So I thought it'd be a good idea to take a look right now and compare where we were just 1 month ago when we last updated and where things stand right now. When we look at the nationwide data, this is a graph of the tests performed per day in the blue bar graph, whereas the yellow line is the percent positivity. That is the percentage of those tests that are coming back positive. Now, these two numbers are really good to look at together, because if the positivity is going up, but the amount of testing is going down, that tells us that we're not doing enough tests. If the positivity is going up, but the tests remaining constant, then it shows us that the virus is spreading, becoming more and more common. Right now, what we're seeing, though, is the number of tests performed daily becoming much less, which makes sense. People are more vaccinated, so they don't need as much official testing as we used to have earlier in the year. That is, when someone has to get a test because they've traveled or something, those restrictions are no longer in place. Also, with fewer cases out there that we're aware of, people have less exposure, and so they have less reason to get themselves tested if they, say, interact with someone. So we're seeing the number of tests dropping for all those reasons, but the percent positivity is also going down. So that means that we are likely still catching most of the cases out there, but there's just fewer and fewer of them. And so the virus is really dwindling, even though the testing apparatus is scaling down, which is good news. When we look at the case counts with the raw counts in blue and the 7-day average of new cases in red, things have continued to drop steadily for several weeks now, since mid-April. We are now seeing on average fewer than 20,000 new cases per day, which is the lowest we've seen since the beginning of the pandemic. We never were able to crack 20,000 last summer. As the surge in the Northeast, that original first wave, was trending downwards, the South and West were seeing spikes that caused things to level out for the early summer before we saw that big spike last July. But that isn't the case right now. Things are still trending downward. We've gotten below that 20,000 case per day average, which still sounds like a lot of people to me, but when you really look at this graph and realize how high we had to extend that y-axis to get everything in there, we have come a long way. Finally, the big one is deaths. Now, the lowest point we've ever gotten since the pandemic really was a pandemic was about 620 deaths on average per day. Now we have seen steadily less than 500 for a couple of days now. And that is another significant decrease. Now, obviously, 500 people, probably more like 475 dying per day of COVID-19 at this stage is still feels like a lot of people, but we have made significant progress getting things lower than they've ever been before. So that's all very good. When we look at the vaccine, 336 million doses have gone out to the country, just under 10 million here in Massachusetts. And 293 million of those have been given out. That's 82 million additional doses given this last month. That counts for almost a quarter of the entire amount given over the entire lifespan of this vaccine. Here in Massachusetts, we've given 7.9 million, which you will note is more than the population of the state. Obviously, most of these are two-dose vaccines, but still nice to see that. So when we look at the actual number of people vaccinated, that is people who've gotten at least one shot, we're at 161 Americans, 161 million Americans, which is 62% of the adult population. Here in Massachusetts, we've reached 78% of the adult population. Now, obviously, this isn't anymore, as was at the end of April, the full population we're looking at these days. People as young as 12 can get vaccinated. So this isn't a percentage of the entire eligible population anymore, but given that's what we've been using in the past, I thought it best to keep that for now. Looking at fully vaccinated people, that's over half of all American adults are vaccinated. And here in Massachusetts, we've got almost 2/3 of all adults in the state fully vaccinated. That is 2 doses of an mRNA vaccine or 1 dose of the Johnson & Johnson. So that is really a long way. We are getting close to, at least here in Massachusetts in the Northeast, we are getting kind of close to some of those projections for what a herd immunity number would have to look like. We still don't know exactly what that would be, but 78%, once those people get fully vaccinated, we're pretty close. And just looking at the state itself, at the end of April, there were 26,000 estimated active COVID-19 cases. Now, there are literally 20,000 fewer. That's a huge drop. Just this last week alone, there have been 4,000 fewer than the week before. So things are still continuing to trend downward in a sharp fashion, which is all great. Looking at how people were quarantining at the end of last month, there's about 9,000. There's 6,000 fewer people in quarantine. Similarly, isolation, this is people with confirmed cases. There were 27,000 people in isolation for active COVID infections. Now there's just over 8,000. You've really dropped off here in the state. So this is all really good news. One of the best news, of course, is in our hospitals. The number of people hospitalized in ICUs and on ventilators, each one of these metrics is about half what it was last month, which is both great just in terms of the fewer number of people who are really seriously ill from COVID-19 and the vast amount of hospital resources that are available, given that we're nowhere near the points where we were overwhelmed early last year. And when we look across the state, as Wave compares, this is, of course, the daily incidence rate. That's the average number of new cases per 100,000 people per day over the last 2 weeks. At the end of April, the state average was 20. Now it's 6.1. That's pretty good. Another way to look at it, though, is at the end of last month, the county with the lowest incidence rate was Franklin County with 10.2 new cases per day per 100,000 people. Every county now on the mainland has lower than that. So that's pretty good. The islands are still higher than that. Of course, those areas with very low population are going to throw off the numbers. So a relatively small number of cases can make the incidence rate seem much higher than it is because it accounts for smaller populations or larger populations there. When we look at the percent of tests that are coming back positive across the state, you can see those have declined similarly, just dropping off there. The overall percent of tests coming back positive, excluding those screening tests done by colleges and universities, is barely 1% at this point. That's huge, considering at the highest points of the pandemic, it was over 8%. Now, we may see a slight increase in this metric as colleges and universities close, and thus we don't have that that metric throwing off our numbers so much anymore, so it may seem comparatively. But looking at that gray line, which shows the Massachusetts tests done that do not count higher education, will continue to maintain a constant barometer for how much of our tests are actually coming back positive. Even just looking at the numbers for Massachusetts alone, in the last 2 months, 3 months at this point, at the beginning of March, we were at what had previously been the lowest parts of the last surge, and we lost some ground there. Things trended back upwards at the last couple of days of March. But looking where 2 months have gotten us, we are seeing less than a quarter of the new cases we were seeing just 2 months ago. And that is huge. It's a massive reduction. This is a lot to do with vaccines, a lot to do with people taking public health measures seriously. Right now, we're at a place in the pandemic where the daily case counts are similar to the lowest we've ever seen early last summer. We could still get them a little bit lower, like we did last year. The combination of warm weather plus now having vaccines maybe drive these case counts down to minuscule levels. And that's where things stand right now. Across the board, things are as diminished as they almost ever been since those first awful surges back in March and April of 2020. But does that mean that we're out of the woods yet? Is the pandemic over? Well, that's hard to say. With this reopening this weekend, we will see a lot of the kind of behaviors that we've put on the shelf for a long time now. And we'll see if those lead to transmission once more. The real test will come in the next couple of weeks when we see, is there any kind of rise in cases as people start to let down their guard? Or have we vaccinated enough at this point that COVID's on its way out, in Massachusetts at least? That remains to be seen. For all the data on this, of course, you can go to mass.gov, the Massachusetts stuff, and this Centers for Disease Control for the nationwide data. And of course, for more from Mass Support Network, you can find us on our website or on social media. And one last thought as we go into this new and possibly, well, let's not get ahead of ourselves and say it's the last phase of the pandemic. But for all the time that we've been doing updates here, I've ended with the phrase, wear your mask, wash your hands, and we'll be there if you need us. Something that's a little different now. Well, wearing your mask is no longer mandatory in Massachusetts. Now, of course, if wearing your mask makes you feel safer, if you're just not prepared to go maskless anymore because you've gone a whole year of wearing one, that's fine. Nothing says you have to go out there without your mask. You can still keep doing that. Washing your hands, well, that was always a good idea. You know, honestly, we haven't been washing our hands nearly as much as we should have been, and this past year kind of caught us up. Now, washing your hands is not a huge way to prevent COVID from spreading, but it is a good practice, and it probably contributed a bit as well to the fact that we essentially didn't have a flu season this last year. And of course, we'll still be there if you need us. So everyone, stay safe.